The organisation Gift of the Givers has been digging for water and sinking a borehole at the Rahima Moosa Mother and Child Hospital after what I suppose you would call the continued failure of the city of Joburg to be able to supply electricity to the pumping station to provide water to the hospital. That's meant women and children needing medical care have not been able to be properly cleaned. In some cases, members of staff, doctors, nurses, working very long shifts have had to use toilets outside, which have been given by charities just for them to try and relieve themselves. There's been no water. Meanwhile, the Charlotte Maclear Hospital still closed in Joburg. Dr Imtiaz Sooliman is the founder of the organisation Gift of the Givers. They've been drilling a borehole. Advocate Bongani Majola is the chair of the SA Human Rights Commission. Dr Sooliman, good afternoon to you. I run out of words to describe the work that you and your organisation have been doing. Firstly, the borehole. Was it difficult to find water?
Fortunately, we were on site today, and everybody said it was fantastic. Let me tell you something. The bore was sighted from Namibia. Dr. Grootes, the hydrologist, actually sighted it from Namibia. He pinpointed a location in the car park of the doctor's car park in the hospital, and we'd go to the first strike. At 46 meters, we found the first water. At 63, we found a little more. At 83, we found a little more. And we went beyond that up to 200 meters, but we hit 18,000 liters per hour. And today the testing team was there to test the water. We brought in the lab people from Cape Town, especially the team that works with us. And they said, look, we still need a bigger test, but in the meantime, it looks like this water is fine for the hospital.
So obviously you won't drink this water, but you will be able to use it.
I drank it today.
Oh. Okay.
We always drink the water on site. You know, you taste the water, you taste it for salt and other type, if it's going to be palatable or not. Yes, it has to be tested, but you have a feel of the type of water that comes from certain type of rocks. The big worry is, because it's an old mining ground, it's a mining area, so is it acidic? It wasn't acidic. Does it have a lot of metals in it? It doesn't have a lot of metals in it. So it's very, very positive. We want to test for arsenic and the E. coli and iron. It already looks now that there's not much iron either. If the two tests come positive and negative, then this water is ready for drinking. But immediately, we can pump it to do all the things that you spoke about. We can wash the linen, doctors can wash their hands, they can wash the floor, they can use it for the toilet and all those kind of things immediately once we connect the pipes into the hospital system.
It's really quite incredible. Dr. Advocate Bongani Majola, the chair of the SA Human Rights Commission, joins us now. Mr. Majola, good afternoon to you. I mean, I'm no lawyer, I'm no expert on human rights, but I understand that patients have a right to treatment and that people have a right to the provision of water. There's obviously a human rights issue in these hospitals.
Well, it's a very big human rights issue. And you are correct, even though you're not a lawyer, but you're absolutely right that access to water is a human right, and also access to health care is a human right, and the right to life is a human right. And the deprivation of patients of water violates their rights. In fact, in one of the hospitals, one dialysis patient passed away because of the inadequacy of water, and so he lost his right to life.
What would you like the Gauteng Health Department, and I suppose the city of Joburg, it's their job to provide water. They failed in their job to provide water, if I can put it like that. What do you expect them to do?
Well, yes, they have failed to provide water to hospitals. In fact, I think that there is lack of foresight and lack of forward planning, because they should know that these sites like hospitals are essential sites, and water should not be easily cut to them. Water and electricity should not be cut to them, because water and electricity plays a very big part in the provision of health care to patients. And if you are going to have load shedding, or if you're going to reduce the volume of water that the hospitals need, indirectly you are affecting the rights of access of the patients to water, to health care, to life eventually for some of them.
Dr. Sooliman,
so what are the departments to do? Chapter 3 of the Constitution requires all levels of government to work together cooperatively. And they are not working together cooperatively. It took the Commission to call the health departments and the various water authorities in Johannesburg to a meeting to be able to hammer out some arrangement for them to ensure that the hospitals do get water. This should have been automatically done by the city administration, the provincial administration, to make sure that whenever there are disturbances in the supply of water, that there are standing plans that kick in immediately. But they don't. They haven't provided reservoirs for some of the hospitals and so on. It's a complete lack of foresight. And I'm not sure whether it shows sufficient care for the lives of the patients that they are caring.
Dr. Sooliman, I mean, the obvious point to make is that you were able to sink a borehole. Government hadn't, the city of Joburg, Gauteng Health Department had done nothing. I mean, you know, they'd called for help, they'd had some sort of emergency water tanker, but they didn't do what you did.
Stephen, what advocate is saying is correct. The problem is the systems in government are just too distant from each other. There's no working together. Hospitals, school sanitation, you know, emergency facilities should have water and electricity all the time. Example, surgery, ICU, they should have generators all the time. In the same way, every hospital in South Africa should have a bowl. You know, and you can't say, the problem with government, I emphasize this beyond many shows, they don't understand three words: urgency, emergency, and disaster. You can sit in the office and say you're going to fill in some paperwork, and somebody behind you has to sign a form, and somebody behind you has to sign a form. Water is an emergency. The patient died from because of renal dialysis. So other children have died because in the pediatric wards also. And we don't know how many more have been affected because of a lack of water. Go to the hospital. The medical workers, healthcare workers are recovering from the first and the second wave of COVID-19, which has been absolutely traumatic, especially in the second wave. Now the staff have to carry water from the ground floor to the 6th floor, one bucket of water. They are totally demoralized. They said in the last 2 weeks, it was many of them said we'd rather go into private practice, but they're staying there because patients need them. There is no excuse. The government can't say, that's why you have emergency rules. Emergency rules allow you to do something immediately. Without saying, oh, how long is it going to take? And even the pro CEO, she was on your show, trying to find out from the rainwater what happened. Nobody's giving an answer for 3 days. You can't have that kind of situation in a hospital. It has to be done immediately. Yes, a bowl won't give you water same time to drink, but at least it can give you water for the hospital, for washing linen, for washing the gowns, all those kind of items. Hygiene, the risk, and now with COVID-19 in the hospital, there is just no excuse not to have water. And the other important point is this some God-forsaken place in the middle of the African continent, in some deep rural area? No. This is the capital of the economic hub of the African continent. It's Johannesburg. If Johannesburg can't provide water to a hospital in Joburg, what do you expect of people in other parts of the African continent? And to be honest, I think they're providing water.
You know, Dr. Sooliman, I've known you for many years. I've never heard you as frustrated as you are now. I've never heard you speak like this. I mean, to watch what you're seeing, and I mean, the point that you make is that this has got a lot of attention because it's in Johannesburg, except there's an urban focus for the media. But this is happening in other parts of the country too, right?
Yes, it's happening all over. You know, I mean, Eastern Cape is not solved yet. There's problems. We're drilling in Adelaide Hospital. We failed. We drilled, it cost us 300,000 rand, and we couldn't get the right rocks because they just don't have the right rocks. But we've got bowls at a distance. We may have to run pipelines from those bowls into the Adelaide Hospital. You know, at some hospitals we succeed. Some Inland Hospital in Grafton, we succeeded to have enough water for the hospital and to load water tankers and to help the community. But it's not only a patient issue. It's a non-patient issue also. It's about the rest of the communities. Everybody waiting for something to happen tomorrow, and 4, 5, 6 years have gone. You can't be saying, you know what, we're going to solve the problem, and we've got problems in the different departments. Government, water, electricity, health services has to be under emergency, some kind of department or something that you act instantly. No long discussion. It has to be done now. It's something that cannot wait for. And I said the only way to test, put the children of politicians and government workers in the same situation and see if they'll take so long.
Mr. Majola, I mean, as chair of the Human Rights Commission, you must see this all the time. I mean, do you agree with Dr. Sooliman says, a lack of urgency? This is an emergency situation. And, you know, it seems the city of Joburg, the Gauteng Health Department, just don't fix it.
Well, I fully agree with him. And I would like just to thank him publicly, because he and I have never spoken, but I've seen the kind of work that he has done. When he comes to the rescue of the people, when local authorities are actually minding their own business and not doing much to help our people have access to water and sanitation. Thanks for that one. But yes, we've seen a lot of these in the whole country. And we have told the portfolio committee that water has now become a crisis, you know. But government is again not picking up its feet, you know, in order to deal with the crisis, because there are many areas in the country where there are worse shortages than we are speaking about here, where people are drinking water together that they share together with donkeys and cattle. You know, and taxpayers' money goes to those provinces, but you do not know when will they actually get to a position where progressively they are providing water to everybody. You know, the taps in some places are not working and so on, and they just don't care. They just don't care, which is a big shame.
And Mr. Majola, I mean, we talk about things like the right to life, the right to health care, the right to treatment, the right to water. This is a strange question, but I wonder if there's a right to working infrastructure. I mean, I don't see that in the Constitution, but I think people do have a right to working infrastructure, and it's just been neglected for years and years and years. In Joburg, Rahima Moosa is an example of that. Charlotte Macleke is an example of that. An official said this week that they're looking for the architectural drawings for the hospital before they can reopen it. I mean, I do think people have a right to infrastructure that works.
Well, I think you are right in the sense that, you know, when something is required, everything that is necessary to give effect to what is required is part of that right. So the right to access water means, therefore, that there has to be the means like piped water, properly piped water that is piped to people. So that infrastructure is part of the right. It's part of the duty of the state to deliver access to water to people. Charlotte Macleke is a hospital, but yes, that is where you can dispense access to healthcare. And so it is a necessary part of the obligation of the state to provide access to healthcare. And so the state has an obligation to make sure that these hospital infrastructure are up to scratch, are up to standard, they are fit for the purpose. We've been around the country and we've seen hospitals whose infrastructure is in a terrible condition, and we have raised this with government, with provincial governments for quite a long time. Attention to it has begun to be focused on it because because of COVID-19, not because the Commission has been raising the problem, but it is a problem. It is a problem with staffing, with infrastructure, with, lots of things.
It's such a big problem. And Dr. Sooliman, I mean, your organization usually gets caught in an emergency situation. An emergency is a lot more expensive than just maintaining infrastructure, isn't it? You actually see what happens to patients who don't get treated. You see it around the country. You're seeing it now with people who don't even have enough food, never mind hospital treatment.
We see it with patients, and we're seeing the effect it's having on medical personnel in the hospital itself. We're seeing the effect it has on the communities around them. Yes, it's more expensive, but, you know, talking about infrastructure and maintenance, maintenance has to be an integral part of any facility, hospitals, schools. You know, it becomes more expensive later on. And we've upgraded hospitals. I mean, in Mitchell's Plain Hospital, there was a wing there during COVID-19 that was disused for many years. We just took it, and in 30 days we upgraded the hospital. We did something similar in Settlers. We're doing that all the time. But, I mean, we're not a government. You know, we're dependent on donor funding and public funding, and there's so much we can do. But with government money well used, you can do so much more. And in fact, government, as part of the planning, should look at upgrading 3 to 4 hospitals every year in every province. And if we do that, we won't have the kind of situation that we have right now. I don't think the infrastructure is looked at. And Charlotte Macleke, what I don't understand is the whole hospital didn't burn. There's one section of the hospital that was burned. Why is the whole hospital shut down? You know, can't at least 2/3 of the hospital be functional now? You have the added pressure of those patients now on Rahima, Moosa, and other hospitals. But besides the pressure on the hospital, those poor patients now have to go much further, to go to another hospital, to go and to be seen. And it just cannot, it doesn't make any sense to me how the hospital can be closed for so long. The casualty area, the pharmacy area got burned. Take another ward. Put a pharmacy inside there. Put a dispensary in that section. But make it functional for something else. And with COVID-19, the numbers are rising the fastest in Johannesburg. And you need hospitals. A year ago, we were running for field hospitals. Now we have hospitals that we shut down. What logic is there?
Dr Imtiaz Sooliman, the chair of the founder of Gift of the Givers Advocate, Bongani Majola, chair of the Human Rights Commission. Thank you both very much indeed for joining me. I do appreciate it. And just to reiterate the point while he's still in the studio, I've spoken to Dr Sooliman for many years. Never, ever heard him. He never heard you, sir, as frustrated as you are now. And I think, frankly, you're probably speaking for many, many people. As you see on your screen, stage 2 load shedding due to start in half an hour. In a moment, we'll have a look at what's happening with our business editor on the markets with Kolani and Batra. Stay with us.